Patients and clients are telling us that changes are needed to make the healthcare services they depend on more accessible and more easily available. Healthcare providers are telling us of their frustration at the gaps in the system that they encounter as they provide patient and client care. The recently released Drummond Report on Ontario's government services stresses that things are going to have to be done differently in the public sector if we're going to get real value out of every public dollar. And Minister of Health and Long-Term Care Deb Matthews has announced an action plan for health care that will be shifting spending away from things that don't improve patient outcomes and focusing directly on things that do. There is no question that change is coming in healthcare. In the Northwest region, we have a clear vision for healthcare and a plan for making the changes necessary to make that vision a reality. Picture this: a fully integrated healthcare system that puts patients and clients at the center of the system, closing the gaps that exist between services and providers so that patients can receive the care they need when they need it, as close to home as possible. Citizens will live longer, healthier lives, and our healthcare system will be there for generations to come. This is the vision we have for the healthcare system in Northwestern Ontario, and together we can make it happen. The Northwest Local Health Integration Network, or LHIN, is one of 14 LHINs created to plan, fund, and integrate healthcare services at the local level across this province. This ensures that healthcare planning reflects local priorities and that there's accountability for every decision made. Our LHIN funds hospitals, community health centres, community support service agencies, mental health and addictions services, long-term care homes, and the Community Care Access Centre. In January 2012, the Minister of Health and Long-Term Care announced that LHINs will also be responsible for planning primary care services. The Northwest LHIN covers a vast area of 458,000 square kilometres, extending west of White River to the Manitoba border. We encompass almost half of Ontario's landmass, but with only just over 222,000 people, we are home to only about 2% of the population. 3.5% of our residents are Francophone, and 22% are Aboriginal, with some of our First Nation communities in areas so remote that they're only accessible by vehicle in the winter via ice roads. Other communities are only accessible by air year-round. The Northwest LHIN is responsible for 13 hospitals, 2 community health centres, 63 community support service providers, 36 mental health and addiction agencies, 14 long-term care homes, and the Northwest Community Care Access Centre, and will become responsible for planning primary care services. Together with our partners, we've already made great strides in improving access to quality care and identifying and responding to local healthcare needs. We know, however, that there's much work to be done. If we're going to create a truly responsive, patient-centered, community-based healthcare system that will support the hard-working citizens of Northwestern Ontario now and for generations to come, there are changes that must be made. Our universal healthcare system is here for us today, but we need it to be there for our children and grandchildren tomorrow. And that means understanding the growing demands on that system and the changes that need to take place in order to meet those demands. The Northwest LHIN Health Services Blueprint is a 10-year plan to reshape, strengthen, and sustain our healthcare system so we can be sure that our children and their children will benefit from the same world-class healthcare that we do. We knew that the blueprint for healthcare in the Northwest needed to reflect the realities of our region, as well as the best current thinking here and in jurisdictions across the country. To that end, a thorough study was conducted by PricewaterhouseCoopers to evaluate our current healthcare system and to predict the system's needs in the future. The study included a detailed look at our current services, projections of future demands and needs, mapping the current and ideal patient journey, and input from stakeholders and providers. All of this information was shared with some of our health service providers and other stakeholders who provided valuable feedback to the findings in the report. The information and data collected in the study makes a very strong case for change. The study found that the Northwest LHIN has a high rate of preventable disease. For example, according to statistics, In the Northwest, more people smoke, drink heavily, and are overweight compared with the provincial average, contributing to risk factors for certain chronic diseases. 25% of people over age 65 have diabetes versus around 20% provincially. 58% of people over age 65 have high blood pressure versus around 51% provincially. 23% of people over age 14 have arthritis versus 17% provincially. Transitions between care settings are not handled efficiently and effectively. There are still many instances where patients have to wait in hospital until home care or long-term care becomes available. Those patients who are sent home don't always receive the proper support and follow-up in the community, and as a result, they often end up back in hospital, especially for conditions like heart failure, chronic obstructive pulmonary disease, and diabetes. The Northwest LHIN has very high rates of readmission for these conditions. Patients with chronic diseases could be managed much more effectively in the community. For example, the rate of major amputations for diabetic patients in the Northwest is over 2.5 times the provincial average. Northwest LHIN area residents have high rates of hospitalizations and emergency department visits for many chronic diseases, suggesting the need for community-based services like primary care through a family physician, nurse practitioner clinics or walk-in clinics, or other community-based programs. The Northwest LHIN has the highest rates of acute care hospital use in the province, and this rate could be as much as 40% lower. The number of repeat emergency department visits by individuals is 28% higher than the provincial average. Patients are visiting hospitals for health issues that could be treated in alternate primary care settings in the community. In the case of small, remote communities, however, this use of acute care might be more appropriate where few alternatives exist. Healthcare costs are higher in the Northwest LHIN, while our share of future healthcare funding is expected to decrease. In 2009-2010, our healthcare spending was 39% higher per capita than the provincial average in almost every sector. We have a large rural and remote population that has challenges accessing the same services that are available in larger centers, and helping people meet those challenges is expensive. Forecasting shows the demand for healthcare services in the Northwest in the future is expected to increase in all sectors, especially for services associated with care for the elderly. Meanwhile, population growth and the growth of healthcare services in the Northwest are expected to be lower than in other parts of Ontario. Given the funding model used by the province, this may result in a smaller share of healthcare funding for the Northwest LHIN in the future, meaning we need to make the best use of our existing resources. More than 95% of all healthcare services used by residents of northwestern Ontario are accessed right here in the Northwest LHIN. This clearly shows that people in this region can and do rely on their local healthcare system, which is why we need to ensure that it is the best it can be for generations to come. Interestingly, very few people use most of the services. Just 1% of the Northwest LHIN's population uses 50% of the total hospital and home care services. Change is needed now in order to address the challenges highlighted above. Change is inevitable. Ontario's population is aging. The province estimates that if we don't change anything, health costs will increase to 70% of the provincial budget within 12 years, crowding out its ability to pay for other important public services. Just because change is inevitable, however, doesn't mean it has to be a bad thing. There are real opportunities that exist through the changes we are planning. Opportunities to meet our population health needs, improve access to care, improve health outcomes, and finally, improve the overall quality of care and the care experience. In changing our system, we have an opportunity to improve the way patient care is planned by putting patients at the center of care. To improve the coordination of services by improving linkages between health service providers and reducing barriers to access care. To share best practices. To innovate care delivery systems. to achieve better health planning for the population at the local, district, and regional level. The overall goal is to create an integrated health system in the Northwest LHIN that results in a healthier population. We need to provide more equitable access to quality healthcare services that are solidly based on evidence and leading practices. We need to move from a focus on hospital-based care to community-based care, as close to home as possible. We know there are gaps in our current system as people move between care providers, and we know how frustrating it is for individuals to have to tell their story multiple times to different providers. We want to reduce this duplication and make the patient care experience better, faster, and safer. In order to have a sustainable healthcare system for generations to come, we must use the resources we have effectively. The Health Services Blueprint will help inform our decisions about the allocation of resources over the next 10 years. The focus at all times will be improving health outcomes for the residents of Northwestern Ontario by delivering the right care at the right time and in the right place, as close to home as possible.